I'm Alexis Kate. I'm a licensed clinical social worker and trauma specialist. Let's go over double depression. Please make sure to check out the description below for all of the resources that we discuss in today's video. What is double depression? Double depression describes the existence of co-occurring depressive disorders, although this phrase is not typically used in clinical settings. Depression encompasses a group of mental health disorders, and while they are separate and unique, mainly due to their symptoms and trigger and also the effects that they have in one's life, they are also intimately connected and intertwined. A person with persistent depressive disorder, or dysthymia, along with major depressive disorder, is said to have double depression due to the way that these separate conditions combine together. When these disorders combine, they create a mix of chronic and acute symptoms. Some conditions tend to trigger double depression, and these include major depressive disorder, or MDD, bipolar disorder, disruptive mood dysregulation disorder, or DMDD, premenstrual disorder, or PDD, and depressive disorder induced by substance misuse. Some of these conditions may overlap, while others are more mutually exclusive. For example, a person cannot have bipolar disorder and major depressive disorder, as depression is a part of the bipolar disorder experience. With double depression, a person has persistent depressive disorder with periods of major depressive episodes. Persistent depressive disorder lasts at least 2 years. To learn more about the conditions mentioned above, we've linked articles that we've published in the description below. How is double depression different from major depression without PDD? The major difference between MDD without PDD and MDD with PDD is what happens in between major depressive episodes. Someone experiencing MDD will experience these symptoms over a 2-week time period, at the very least. When their symptoms are remitting, a person experiencing MDD may experience improvements in mood, improved energy levels, increased motivation, just like someone that does not experience depression. However, someone with chronic depression, PDD, will continue to experience low levels of sadness and feeling down. These symptoms continue between major depressive episodes. In a way, this person will feel as if they are never happy and will always be experiencing some level of depression. The symptoms of double depression will involve separate diagnostic criteria for each disorder. When a person meets the criteria for both MDD and PDD, they are experiencing double depression. The symptoms of MDD include depressed and irritable mood for most days over a 2-week period, less interest and pleasure in generally enjoyed activities, changes in weight, appetite, and sleep, either sleeping too much or too little, feeling sped up or slowed down behaviorally, having low energy and low motivation, feeling guilty and worthless, poor concentration, and thoughts about death, dying, and or suicide. Please note that if you or someone you love is experiencing suicidal thoughts, help is available by dialing 988. A person will need to have displayed at least 5 or more of these symptoms over a 2-week time period in order to receive a diagnosis of MDD. The symptoms of PDD include low mood more often than not over a 2-year time period, low appetite or overeating, too little or too much sleep, fatigue, low self-esteem, poor decision-making skills, and feelings of hopelessness. Someone would need only 2 or more symptoms to meet the criteria for PDD. However, as mentioned, the duration of these symptoms is the most critical element of this condition. When enough symptoms of MDD and PDD are experienced, a person is experiencing double depression. Some people with double depression could be experiencing increased irritability and even physical health conditions as a result of their symptoms. A person with double depression could show slow yet significant changes in weight, appetite, sleep, ability to engage in generally enjoyed activities, and these shifts can occur gradually or over time. Here's what double depression may look like depending on your age. For adolescents, due to the nature and chronic features of double depression, it would be rare for an adolescent to have persistent depressive disorder diagnoses. However, teen depression is very real and does absolutely occur. Adolescents can often show signs of low frustration tolerance, restlessness, low self-esteem that are often linked to depression. For young adults, they are more likely to show irritability, depressed mood, weight gain, and oversleeping habits. They could complain of a combination of depressed mood and anxious mood, and they may try to conceal the depressive mood that they feel by consuming drugs or alcohol. For middle-aged adults, there's often complaints of stomach issues, such as constipation and diarrhea. They could also have a lower libido, wake up more often in the middle of the night, or wake up way too early. Older adults often feel numb rather than sad or depressed. When depression is severe enough, it could significantly impact their memory or thought process. How is double depression diagnosed? While double depression is not itself a diagnosable mental health condition, the two disorders that we've discussed, MDD and PDD, are diagnosed by a licensed mental health professional. People with these types of depression are often monitored over a significant period of time, especially in order to justify the presence of both depressive disorders. It has been found that people experiencing depressive disorders benefit greatly from medication interventions as well as talk therapy. This is especially true when both are done together. Someone that struggles to respond positively to talk therapy may greatly benefit from medication. However, first and foremost, your thoughts and feelings should be honored. To learn more about treatment for depression, we've linked videos that we've published on therapy and medication for depression in the description below. If you feel like you have symptoms of double depression, you are not alone. To find a therapist or mental health professional, talk to your primary care doctor, reach out to your insurance company for in-network providers, and consider the use of an online directory in order to find providers in your local area. We've added links for resources below to support you in finding a therapist, psychiatrist, and other useful tools.